joining me via Skype is a public affairs analyst, Ayodele Adewale. Good morning. Thank you for joining us on TVC Breakfast.
Thank you for having me.
All right, I'm certain that you have been monitoring the impact the coronavirus or COVID-19 pandemic has had on even countries that a lot of persons thought had the structure in place when it comes to health. And we see that how they are struggling under the weight of the pandemic. And while this pandemic was still moving across the globe before it got to Africa, WHO was raised some concerns with regards to Africa's weak health system, which includes Nigeria. And the pandemic has begun to, reveal and expose the strengths of many countries' health sector. So far, what have you seen, or how has this revealed how weak our health system is in this part of the world?
Well, first and foremost, my condolence to those who lost their families and loved ones in this pandemic. And we have two different cases before us, countries that have very good structures, but again, did not manage the information and did not take seriously the issue of this pandemic. They rather politicize it. And that does not mean that their structure is not big enough, is not enduring enough, but they only politicize and mismanage the information. Coming down to Nigeria is a totally different case. Here is a country that is still battling to put its structure right, particularly at the local level. Community health is a local issue, and if Nigeria has gotten its community health program very rightly at the local government level, we need not to be afraid. The central government only need to monitor and aggregate issues as it comes. Be that as it may, we still have an opportunity to do what is right. I commend the Lagos State government for taking a bold step to show leadership and direction in curbing this issue. But again, I want the Lagos State to also demonstrate a unified system where infrastructures can quickly be put in place. I must also commend the GTB for putting up that structure within 5 days. I bet you, if you look at the direct cost for purchase of material of that infrastructure that was provided at the Mobalaji Johnson Arena, it will not cost up to 400 million naira. Direct purchase, putting everything that we need in it. So it means that with the 10 billion naira that the federal government has given Lagos State, Lagos can replicate it in 20 local government of the old structure. It means that with putting that in place, even after the pandemic had gone, we can still use that as our primary health care structure for any misgiving that can come in future.
All right, if I may interrupt your line of thoughts for a minute. As much as we would commend Lagos State, Lagos is one of 36 states of the Federation. And we know that the virus moves around. It is not static. Unlike what we saw during the Ebola crisis, we saw that it was tackled head-on, and Lagos also, took the lead by ensuring that it curbed the move of the Ebola crisis at the time. But then a lot of persons said, what the lessons have we learned if we took the step at the time, but it doesn't seem that we learned the lessons at the time, such that the structures we had in place at the time, we ensure that those structures remained on the ground, and so they are not optimistic that the crisis that we have been able to deal with over time, and now we may not be able to say we learned the lessons and we will build the structure after now.
The lesson we should learn is that we must put more funding into health. Without health, good health in place, there's nothing that can work. And this pandemic has been able to show us that global economy is shutting down rapidly. Nigeria should learn that at least 25% of its budgetary allocation must go into the health sector, building infrastructures and also building capacity. The Ebola issue, in terms of nature, is different from the coronavirus. You understand? Because this one is easily transmitted, and of course, they've also said through airborne and water view, people can get it more easily. I think Nigeria should have learned from what Ghana did. We should have shut our borders very early. People traveling into Nigeria, especially through the airport, should have been quarantined. Either you have it or not, they should have been given the best quarantine environment that will even make people naturally submit themselves into such processes. But again, we have to look ahead and see what we can do. I want a situation where Nigeria would deploy more of its educated forces that we have, and I use the word forces conscious. I'm talking in terms of medical forces. You can't deploy people from the School of Hygiene. You can't deploy people from various school of medical institutions, because these people are readily prepared to educate people and, of course, render services. If Italy can hastily graduate a lot of its medical students to fight this pandemic, I think we should also look towards that line. It's not just to give directives that people should stay at home and all whatnot, but we need to get the right people that can communicate effectively to the Nigerian populace and make them understand why they need to stay at home. Beyond that, Nigeria also must, take its data very consciously. We can't borrow
we have
data
to leave
from the banking
the
sector.
discussion at this point, Comrade. Thank you so much for speaking with us. Joining me via Skype is a public affairs analyst, Ayodele Adewale. Thank you for joining us on TVC Breakfast.
Thank you for having me.
At this point, some persons have said that the capacity in talking about medical personnel, that we do not have that, and so perhaps we should be looking out for help like we see some other countries like Italy doing. What do you make of this?
Well, I do not think I differ from that thought. We have a lot of skillful hands in Nigeria. What we need more is to encourage them and, of course, create incentive for them. And beyond that, we also should create some level of insurance to guarantee them that peradventure anything happens to them, their dependents will be well taken care of. Considering our population, considering the various academic institutions that we have in Nigeria that provide for medical training and all of that, I think we have enough hands to tackle the issue.
All right, moving away from the hands now to tackle the issue. We see some other countries liaising with private hospitals to ensure that they have capacity, that they increase capacity with regards to, excuse me, curtailing the spread and as well as treatment. Do you think that that is something we should be looking at as well, collaborating with private hospitals across the country to increase capacity?
We need all hands on deck. All hands on deck, public, private, whatever. As long as these people are skillful and they can deliver the deliverables, we should try to form a synergy and tackle this dreaded virus headlong.
And then there is the case of donations being made. We see some well-meaning Nigerians making donations, and a cross-section of Nigerians are concerned that perhaps instead of the monies, equipment are better needed at this time.
Well, I differ a bit. If you ask them to bring equipment, then we might have more than necessary that we required. What should happen is that the donor should form a bucket, and the government should also come into that bucket, and the two of them should form a very good synergy that will bring up a budget of what is needed, and of course account for every expenditure that is carried out, and give timely information not only to the donors, but of course the Nigerian people, just as we are doing now, telling people the numbers of the patients that are springing up day by day. So rather than just donate money only to government, I believe that the donors should come together and assist government, and both of them work out a structure that will account for the expenditure and, of course, try to get everything that is required.
Now, with regards to the health sector, at some point in the country, there was an Abuja Accord where a certain percentage of the budget was agreed to be, be what is given when it comes to budgeting for the health sector. But we are yet to see that. And some persons have said that perhaps that is where we need to begin if we are to really revamp the health sector. What do you make of this, seeing that there is a challenge when it comes to funds in the country, paucity of funds?
Well, we should look at our need requirement. As it is now, there's no country that can survive without a very good, healthy population. And I've often said in your station that the key parameters that can watch and make sure that government is effective with their budgetary implementation is the media and the civil society. So the media and the civil society must always keep watch, and they must always help government to carry out its functions. Regardless of the fact that we always have political leaders in any political structure, but these leaders cannot see everything 360, what is happening within their domain. So we need civil society organizations to come up and monitor this budget and make sure that it is effectively utilized, and of course be part of the budget bring up from the initial to the conceptualizing point where it is firmed up into a document. We should not allow political leaders or institutions alone to carry out a lot of these sundry matters. Everybody must come together to achieve this purpose.
Invariably, what you're saying is that civil society has failed in its role to bringing the government to account. Is that what it is?
Civil society have not failed. They've not failed. I won't say that. I will only say they have to be more proactive to making sure that the knots are unloosened. We are very mindful that in some corners of the country that some government institutions do not readily operate a transparent policy. Civil society must engage them headlong. The media must also do same. And I will commend TVC, especially I've been watching a particular documentary that you've been doing, showcasing the happenings in a particular local government in Anambra State. You also did that, I think, in Kaduna State at a point. We need more of this, of these things to come up. The more you expose the inefficiency of some government institution, the more it helps us to narrow down and to make them be very effective and accountable for whatever they've gotten.
How critical is the aspect of citizenship engagement to ensuring that governments are brought to account in terms of ensuring transparency and accountability?
You must understand that power comes from the people. Every 4 years, the political masters or the political players go back to the people to relinquish, or should I say, to revamp the legitimacy of their staying in power. And as long as that process will continue, the people also must continue to engage their political elective officers, either appointed or whatever, to make sure that they deliver on their promises. You don't just elect them and go back to sit down and think that they will carry on all of these sundry matters effectively. A lot of them also can be carried away by so many intricacies in the corridor of power. So you must continue to put them on their toes. You must continue to engage them with the promises that they've given to you before you gave them the legitimacy for power. And the people matter always. The people must play their role, and the civil society must assist the people to coming together to play this role. And like I've often said, the media must help to open this gateway for people to see whatever system they put in place and to know how effective these systems are.
All right. Comrade Ayodele Adewale, thank you so much for speaking with us at this time. Well, joining me via Skype is a public affairs analyst, Ayodele Adewale. Thank you for joining us on TVC Breakfast. Now, if we are to address the rot, as it is said, in the health sector, where do we begin? Do we begin by providing infrastructure, personnel, or finance? What do you think, or where do we begin?
Well, the basic thing is to provide infrastructure. You must understand that government is built from the bottom up. The public health institution at the local government level at this point must be very enhanced. There must be a national program to design a particular concept, structure for the local government that they can all adapt and adopt. These are no strange things. They are not superficial things that can be done. But because of our DNA now, we can deploy makeshift infrastructures to local government that do not have any such infrastructure to cater for this particular need.
And speaking about the budgeting, what was required or what was agreed at the time of the Abuja Accord was about 15%. If we are to look at making budgetary allocations for the health sector, what would you suggest?
Well, looking at our contemporary issues, I think we need to take it up to 20%. We've seen with this coronavirus crisis now that our economy cannot move, humans can't move, everything is just static. So that tells you that health is very, very important in this scale of priority. The second that follows it is education. These two primary areas must continue to be invested on, otherwise we would lead ourselves to extinction.
Now, another aspect is the aspect of the president some time ago talked about building about 10,000 healthcare centers. I wonder how much difference this would make.
Well, the president don't need to do it directly. He don't even need to do it directly. All he needs to do is work with the state government and work with local government particularly. When you talk about this issue of pandemic, you must understand that these issues are more prevalent at the local level. So government should focus more on primary health care and make sure that they are very enhanced, make sure that they are very monitored, and make sure that you have square pegs in square holes. There's no point in you having a local government chairman who do not understand the intricacies of building government and building society, and you just put them there like armchair for you to just rest your systems on. If we continue to do this, we will continue to lead the society into chaos. This is a wake-up call for all government at various structures to wake up to their duties and make sure that we put square pegs in square holes.
All right, Comrade Ayodele Adewale, thank you for speaking with us on TVC Breakfast. Well, let's remind you